Hi, this is Dr. Rajesh Khanna, and today we're going to talk about recurrent pterygiums and how to manage them. Recurrent pterygium is if a pterygium has been removed and it comes back, whether it comes back within a few weeks and months or within a few years. The best way to prevent recurrence is to do good original pterygium removal surgery, which we talked about in a previous video. But let's say now that the pterygium has come back, what are the options and how do you manage them? It's best to measure 10 times and remove once, and so the planning in removing a recurrent pterygium is equally as important as the surgery itself. We need to get the previous records and find out exactly what was done, because that can give us an idea of why the recurrence occurred, and if an autograft was used, would there be enough tissue to use again, or we have to use an amino allograft. It's very important that the dryness be controlled on a war footing. That means moisturizing drops, eye ointment, Restasis or cyclosporin, and punctal occluders, and also UV protective sunglasses, humidifiers at home. Before the surgery is done, a month before approximately, mitomycin injection should be made into the body of the pterygium. Usually 0.1 ml is sufficient, and mitomycin C is an anti-cancer agent. What it does is it kills the cells, including some of the blood vessels, and causes the pterygium to shrink. Therefore the boundaries are easily discernible and more easy to dissect out. Since the eye has been irritated before, this surgery could be more painful than a regular pterygium surgery, so it's better to have both topical and oral, and sometimes even maybe IV pain medications available so it's comfortable for the patient. So the steps of the surgery may be initially similar to the ones for ordinary pterygium surgery, but each one requires more care. So the first step is to identify the borders of the recurrent pterygium and mark them out with a marking pen. While dissecting out, we have to be extra careful about the muscles, the eye muscles like the rectus and the obliques, because the recurrent pterygium fibrosis can attach to these muscles and we don't want to inadvertently cut them. If the autograft has been previously used, we would need an allograft to cover the bare area. And once again, mitomycin C can be applied to specific areas of the Tenon's capsule. Controlling the bleeding is very important, and in the end, patching the eye and having a good regimen of post-operative drops is the key. And one of the most important things is afterwards, you have to watch the area of surgery like a hound to look for any early signs of recurrence. If it's been well operated, there should not be any chance, but it's imperative that the surgeon watch out for any early vascularization or fibrosis, which can be again treated either by good hydration, mitomycin C injection, and sometimes with just local resection. Thank you.